Get Healthy Cincinnati from the Christ Hospital and these local partners.
I'm Dr. Egnaczyk. I'm a cardiologist with the Christ Hospital. A healthy heart pumps blood filled with its nutrients and oxygen throughout the body. And part of that function as a pump is that it needs energy. And it receives that energy through arteries that lie on the outside of the heart called coronary arteries. And the most common cause of heart disease in America is due to blockages in those arteries called coronary atherosclerosis. There are multiple risk factors for heart disease, and some are out of your control, like a family history of heart disease, but there are many that are within your control. And these focus around controlling your nutrition, being more active and exercising, and quitting habits like smoking. What I often tell patients who are smokers is that more so than any medication, test, or procedure that I can offer you, stopping smoking is going to be the single most important thing to getting improvement in your heart health. Alcohol is interesting in that we think moderate alcohol use is actually beneficial to the heart. It probably leads to fewer heart attacks over time. But when we say moderate, we mean 1 glass of wine, one can of beer each night is the limit. Anything in excess of that over time can lead to cardiomyopathies, which is a weakness of the heart muscle, and to heart failure. Well, stress can play havoc on the heart. It can cause it to work harder and function faster than it needs to in certain situations. And we know the stress builds up hormones in our bloodstream that are very toxic to the heart. And these can lead to not just the pumping deterioration in the heart, but as well as arrhythmias and palpitations. So there's a whole host of things that can go wrong with stress. And so relief of that stress, or ways to modify it and to decrease it, are very important in keeping a healthy heart. The heart is a muscle. And like any muscle, if you don't use it, it deteriorates and doesn't function as well as it should. So to have a healthy heart, you want to have a healthy muscle. And so that is why exercise is very important to keeping that muscle strong. One of my favorite tips to give patients when trying to motivate them to exercise is to keep it fun. If it's something that's fun and you're motivated to doing it, then you're going to do it more often. And that's an important habit to have, and certainly an important habit to have a healthy heart. A good diet is very important in keeping your heart healthy and strong. A good diet is free of fats, which are important building blocks of the plaques that form in our arteries and lead to heart disease, as well as a good diet is low in sugars and excessive sugars, which can lead to diabetes, which we know it plays havoc on multiple organs, but in particular your heart. You know, omega-3s are found to be beneficial for heart health, and there's a couple different sources for them. There's obviously food sources, which the highest levels tend to be in fish, but also some grains and nuts as well. But I would think the over-the-counter supplements are as adequate in terms of giving your body the amount of omega-3 you need on a daily basis. I think we find that omega-3s in part help lower a type of fat called triglycerides. And we know that triglycerides, elevated levels of triglycerides, are a factor in coronary atherosclerosis. So omega-3 in part allows for contributes to a decrease in these levels. As well as omega-3 is important in terms of stabilizing the heart, we think, from an electrical standpoint, preventing arrhythmias. So that's also, other research studies suggest that it plays a role in preventing arrhythmias. Lots of Americans do have heart disease, and they come in with different symptoms of chest pain, shortness of breath. And I don't want these to be limiting factors in their lives, that we actually have quite a few therapies and things to offer these patients so they can live a full life. So if they do develop heart disease, that we can really make quite a difference in their life, and not to feel like this is a prescription to sit at home and in front of TV all day. We can really get them feeling better, and just to keep the dialogue open with your physician about your symptoms, and I think there's a lot we can offer these patients. So obviously we want to try to prevent heart disease first, but fortunately we can offer them a lot of hope and improvement in their health.
Brought to you by the Christ Hospital, 5 WLWT, and the Inquirer.